chose to do my project over fentanyl. Here's a little background slash intro. I am choosing to do this project on opioids focusing on fentanyl. Over the last few years, we have been hearing more and more about this drug and how it has been abused by many people on purpose and even on accident. Here is some background on this drug. Fentanyl is a synthetic opioid that is 80 to 100 times stronger than morphine. Pharmaceutical fentanyl was developed for pain management treatment of cancer patients, applied in a patch on the skin. Because of its powerful opioid properties, fentanyl is also diverted for abuse. Fentanyl is added to heroin to increase its potency or to be distinguished as highly potent heroin. Many users believe that they are purchasing heroin and actually don't know that they are purchasing fentanyl, which often results in overdose deaths. Clandestinely produced fentanyl is primarily manufactured in Mexico. Recently, it has been a big deal with mixing cocaine and often killing people due to the overdose because they aren't aware that there is fentanyl present in the cocaine. Even though fentanyl was made for chronic pain, it has a dangerous side effect. Effects in overdosing. How it works on the body and the brain. Fentanyl works by mimicking the body's natural painkillers, endorphins. These control the pain/emotions by blocking pain messages to the brain, which opioid drugs bind to these receptors. They can drive up dopamine levels in the brain's reward areas, producing a state of euphoria and relaxation. Fentanyl's effects resemble those of heroin and include euphoria, drowsiness, nausea, confusion, constipation, sedation, addiction, respiratory depression, and arrest, unconsciousness, coma, and deaths. Overdosing. Fentanyl has made Americans' opioid epidemic already the deadliest drug overdose crisis in the U.S. In U.S. history, even deadlier. In 2015, more than 52,000 people died of drug overdose. In 2016, the total rose to more than 64,000. A spike in fentanyl overdose deaths was a key contributor. Overdose deaths linked to synthetic opioids like fentanyl jumped from nearly 10,000 in 2015 to nearly 20,000 in 2016, surpassing common opioid painkillers and heroin for the first time. Fentanyl deaths are becoming more and more common now because it is being mixed into other drugs. Mac Miller, a famous rapper, died in September 2018 due to the drug overdose, and they found that his cocaine was mixed with fentanyl. Prince was also suspected to have died of this too. Results of fentanyl abuse. It should be noted that some people will become addicted to fentanyl without ever abusing it. In other words, they will only take it as directed by their doctor, but they can become completely addicted to the drug on a physical level. This person can usually be weaned off the drug by a physician and not need further treatment. But when a person uses this drug for an escape from life problems, the addiction is going to be both physical and psychological. This person will need drug rehabilitation to recover on both fronts. More side effects include nausea and vomiting, dizziness, drowsiness, tiredness and weakness, shortness of breath, swelling of hands, feet, and ankles, headaches, and addiction, and of course, overdose. What is law enforcement doing? Law enforcement has been out of the picture but is slowly coming back in because all the deaths happening. Since fentanyl is a legal prescription drug, it didn't fall under Schedule 1 of the Controlled Substances Act, which would have made it illegal. In response to this problem, the Drug Enforcement Administration in February 2018 issued a temporary order to place all fentanyl-related substances that are not already regulated by the CSA into Schedule 1 criminal penalties. These penalties will now apply to anyone who illegally makes them, distributes, imports, exports, or possesses fentanyl-related substances. The order is effective for 2 years, with a possible 1-year extension. This will make it easier for law enforcement to deal with the explosion of fentanyl-related trafficking and overdose deaths. Treatment. When somebody stops using the drug, withdrawal can be extremely painful. Some symptoms might include muscle pain, diarrhea, vomiting, nausea, sweating, abdominal pain, and cramping, rapid heart rate, insomnia, tremors, and anxiety. The treatment for addiction to fentanyl includes the use of FDA-approved medications, methadone or naltrexone, prescribed and managed by a healthcare professional. It also includes professional therapy and recovery support systems, such as group counseling. Can anything be done to reverse fentanyl overdose? The medication naloxone can reverse fentanyl overdose, but because the opioid is so potent, patients often require much higher doses of the medication to be successful. Case in point, Prince received Narcan in the days before his death, but it didn't work, law enforcement officials reported. That's all I have today. Let me show you my papers real quick.